mic check with Shri O.P. Singh ji. Singh Saab, I hope you can. I think we've sort of lost him for a bit. Yeah, no, he's right there. He's right there. Singh Saab, can you hear my voice, sir? I think we can.
Okay, some echo is there. I think some. Okay.
I think so. We've already crossed the 180 mark, so we'll be soon touching 200. So meanwhile, Akhil, are we ready with the video clip?
Yes. Yeah.
So before we make any sort of beginnings for today, I would like to welcome our honorable chief guest, Shri Rajendra Singh ji, member NDMA, who will be delivering the inaugural address. I would like to also welcome Dr. Muzaffar Ahmed, former member, National Disaster Management Authority, and a member of FICCI CIDM board. A very warm welcome to Shri O.P. Singh ji again, former DG NDRF and DG UP Police. Professor Chandan Ghosh, senior professor, head at the National Institute of Disaster Management, and of course, Major Len K. Bindal, who although his best wishes and his support is always with us, he's recovering from COVID, so he would not be able to make it, but I'm sure he would be happy that we are conducting this program today. And of course, Lieutenant Dr. J.R. Bhardwaj, chairman of CIDM board at FICCI, former member NDMA, who would be joining us very shortly. Namaskar, O.P. Singh Saab. I hope I'm audible.
Sure.
Sir, you might have to unmute yourself, sir. We'll just do a quick check with Singh Saab.
It is okay. Only. Yeah.
I think he's trying to unmute. Singh Saab, if at all the unmute button is not working, you might have to sign out and sign back in. Sometimes it gets stuck in the process of signing. You are unmuted now.
All right.
Yes, we can hear you, sir. Yes.
नमस्कार सर, नमस्कार.
नमस्कार.
कैसे हैं आप?
I'm so happy online. I'm so happy. Yes.
Thank you, sir. Thank you.
Thank you so much for joining us, Singh Saab. Thank you. It's a great pleasure to have you with us. So quickly, sir, we're getting on. Before we get on to the business, my colleague Akhil will play a short video clip of Shri Lavendu Mansingh Sahab, a retired IS officer, Gujarat 1970 batch, a legend in his own way, a true inspirer. I think, Akhil, can you please play a video while we play? We observe silence also looking at his pictures. Over to you, Akhil. A lot of what we have achieved, and I'm sure, Singh Saab, you must have met him a number of times, even on our platforms.
Yes.
A true inspiration for a lot of people, a great mentor, always had something very exciting and very interesting, very up to date with whatever was happening around in the country, not only in our country, but in the world economy. He was the former DGFT also. So he and former Secretary Consumer Affairs. In fact, it was under his leadership that the Jago Grahak Jago Abhiyan movement was started. So an achiever, and may God bless his soul and he rests in peace. So on that note, with your permission, honorable member, we would start the proceedings for the day. I would
Please,
just,
sir, please do.
Thank you so much. Thank you. So, ladies and gentlemen, a very warm welcome. Wherever you have joined us, we are already above 200 and we are expecting this number to go up. This a very important online training program, which is titled around the second wave of COVID-19, and we would talk about and focus on logistics, supply chain management. We are very privileged to have some very distinguished guests, national leaders amongst us, who would be setting the perspective before we get on to the 3-day business of lectures and presentations. I would just briefly share a background and set the tone in my own way from an industry's perspective. Ladies and gentlemen, the world is grappling with the human and economic crisis which is unraveling before us. The supply chains are finding themselves squarely within the public eye and experiencing unique challenges of their own. In 2019, during the start of the year, as COVID-19 was taking its toll across the globe, experts were focusing on supply shocks as there was no stocks. Say, be stocks of goods or essential medical items, companies scrambled to sort out what production was feasible and what demand could be met. At that moment, it made sense to think of supply chain resilience. We have previously talked about the lessons learned on industrial safety, multi-hazards scenarios, and we now are speaking on disaster resilience for global value chains under threat. Secondly, there was demand of various stocks as the pandemic crisis deepened and nations have begun instituting lockdowns. Supply chains have been experiencing something completely new, systematic demand shocks, where people are stocking up on consumer staples in order to comply with restrictions on movements, in some cases buying months worth of goods in a single day. The most talked about example, normal medicines, which ironically, usually the go-to example of a perfectly forecastable product, since the end consumption is usually rather stable. There seemed to be a fear that medical supply chains would be unable to respond to this unprecedented massive spike in demand. In our country itself, in India, we've seen there has been scarcity of various essential items of some medical equipments, medical supplies like oxygens, is one of those examples. Companies ranging from steel makers to refiners to logistic firms have extended all they can, to help by retooling their processes to produce oxygen for the sick and transporting medical equipment as supplies at hospitals dwindle. We have various examples from the corporate sector: Jindal Steel, Adani's and Reliance, Vedantas. All of these bigs have volunteered to supply oxygen from their plants. Cargo logistic companies have offered, ships with full of oxygen concentrators, oxygen cylinders. Aid agencies globally, USAID, UKAID, Japanese, all of these big aid agencies have come forward as well. India Inc. is going all out to lend a helping hand as COVID cases continues to surge. In one of the tweets, what the champion of Adani Group, Mr. Gautam Adani, he said that the company was on an urgent mission to secure oxygen supplies from across the world. The shipment with various cryogenic tanks with 80, multiple tons of liquid oxygen on its way from different parts of the country, from the world, especially Saudi Arabia. This 3-day online program will discuss those relevant subjects, those relevant topics around the supply chain management and understand the problems what the COVID-19 second wave has also brought to us. The recommendations and outcomes of this discussion will form the basis for future planning with policies so as to avoid such types of incidents or scarcities in future. On behalf of CIDM Board of FICCI and NIDM, it is my pleasure and privilege to welcome all the esteemed speakers national leaders and delegates for taking out time to be a part of this 3-day online training session. I wish that we have a successful 3-day session. On that note, I would request Professor Chandan Ghosh to, if he wants to add a few lines, and also welcome on behalf of NIDM before we go on to Shri O.P. Singh for his keynote address and the inaugural address, followed by Shri Rajendra Singh. Over to you, Professor Ghosh.
Thank you, Rubab. Even though it is with a sad beginning that, we would not say sad beginning, but with a sad note that shared over that CIDM member and Man Singh Saab is no more. I had the fond memory as well as mixing with him whenever CIDM programs are there. So let his soul remain in peace. To all our participants, that more than 250 now, and with Honorable Member Rajendra Singh Saab, who has kindly agreed to go beyond in a he has faced almost 16, 17 days of COVID. So COVID, and even then he has made himself available. So it is a sheer encouragement for all of us, both NIDM and also FICCI and all our participants across the globe. And our also this O.P. Singh Saab also, who has tremendous knowledge as well as sharing and practical as well as, implementation, both being positioned at NDRF and also UP Police. And now he is much more busy than what he has been doing, I think. So while interacting with him yesterday and day before yesterday, Singh Saab, you are evergreen. You are most welcome to share your experience over this platform, that which we thought that it should be timely, as well as rather we are not looking into any of the political or any other issues, more on scientific basis. And that is why in this program, just in brief, I want to say that we have got Dr. Yuri Arashovsky from who is a chief data scientist, RSRL research initiative from Israel, along with Chitra Majumdar, who is based in Zurich. They have developed a model which they are going to present today, the last lecture. So in fact, the thing is, why second wave is gripping too hard to India? And then who will tell us then these people? The doctors are busy. And paramedical staffs are busy, supply chain, they are busy. But who will tell us in this occasion to us that what so far the data that we have been taking so far and what it has been projecting for India and other countries. So that part, of course, scientific background, with statistical background, with the kind of model that which has been fit into many of the countries, including Israel, that will have today the lecture by Dr. Yuri Arashovsky, and also coordinated by Dr. Chitra Majumdar. And in fact, today we have, of course, Mahesh Chandak. He's a head and South Asia and HSC business partner for crop science, Asia Pacific, from the company Bayer. And unfortunately, I called one family member, Mr. Yogesh Chopra, who has been going through the hurdles with his entire family, 2 children, his wife, himself, and his father. In fact, how he has gone through the treatment process and how thankful that he has been to the medical system, especially in AIIMS. But unfortunately, yesterday onward, he is getting some post-COVID syndrome where coughing is not allowing him to speak anything more. So he says, apology, but I say that, okay, we'll see that in this next 2 days, if you are becoming all right, then we'll sure call you up on here in this platform, that what is the system, how it was going on. And then on day 2, we have got one doctor who is going to talk about the vaccination and what are the preventive measures, what are the alternative medicines and everything available from Madhikari, that Kodagu Institute of Medical Sciences, Dr. Ramchandra Kamath. He is going to prevent our COVID prevention and vaccination, whatever drive is going on in the country. And also, we'll see that Sarabjit Singh, who is an emergency specialist in UNICEF, he is going to talk about dynamics of emergency and preparedness during disaster. He has vast experience. He is going to share with us. And then we have a professor from JNU. We have a professor from JNU, Professor Ritupriya, who is very much involved with the Indian health system as an advisor to National Rural Health Mission. And she will be talking on health system and community wellness priorities that, and her experience as an advisor in the Ministry of Health and Family Welfare and also National Rural Health Mission is going to share tomorrow. And then we have a professor from IIT Delhi, Professor Basan Matsagar, who is involved as an expert team consisting of IIT Delhi, IIT Kanpur, and then another two, one from Bangalore, and also another institute, which he is going to tell that under Principal Scientific Officer, Principal Scientific Advisor Office, they have formed a O2 mission, oxygen supply and also production mission. So he has been involved in this mission for the last 15 days. What are the projects they have sanctioned and what is the way out in the next few weeks of time, and how government has been encouraging this companies, especially in India, to produce oxygen in all the forms, whether it is a machine, whether it is a liquid form or cryogenic form. So he is going to tell us tomorrow in the last lecture. And also we have two persons who are really making that one. Dr. Pierre Sharouf from Construction Industry Development Council. Dr. Pierre Sharouf is very much well known in the construction industry, but he has made a group, COVID Command, CIDC COVID Command Center group, where hundreds of people are coordinating about the logistics. So he'll be sharing his experience. And whenever disaster occurs, he shares. He made a group using construction industry and other allied individual as well as industry into that. Along with that, we have got one Mr. Pravash Misra, who is in fact producing or supplying and giving design about the oxygen plants machine throughout the country, even abroad also. Pravash Misra is going to tell about that in Faridabad, in fact, that how he is helping this group to develop a geologist based oxygen plant, which is the most wanting in the current scenario. In fact, that is the reason that we have planned this program over here. And also we'll see that about the supply chain management from the different aspect by Dr. Anirudh Roy, who is a VP, Vice President and Chief Technological Officer from Genesis, Bombay, who has vast experience in dealing with supply chain management. And in fact, he is a GIS specialist and many more technology that he knows. We'll see that on the day after tomorrow he is going to share. So with this brief, I would say that I hope the participants are now almost touching 300. Of course, it is, I would say that we'll carry forward this 3 days program starting every day at 2 p.m. And it will be really experience as well as sharing whatever we have emotionally, as well as scientifically, as well as knowledge-wise, as well as database that which are floating, and the scientists, professors, and thinkers and managers, all they are welcome here. We tried our way to communicate these things to our audience as well as to the world body through this online program. Without much adding, I thank you, Vibhav, for this program.
Thank you so much, Professor Ghosh. As Honorable Member NDMA Rajendra Singh ji has a hard stop at 2:45. OP Singh ji, can I request, is it okay if we can have his address first, please?
Sure. He can go ahead.
Thank you so much. Thank you, sir. Thank you. Thank you. I thought, we wanted to hear, and sir has a meeting with the secretary lined up. So, ladies and gentlemen, Shri Rajendra Singh, member, National Disaster Management Authority. Brief background before I quickly request him for his inaugural remarks. He was in the range of Indian Coast Guard from February 2016 to June 2019, a resident of Dehradun. Director General Rajendra Singh joined Indian Coast Guard in 1980. DG Singh, sir, did his primary and higher education at Dehradun and Missouri. During his service tenure, erstwhile DG held various important command and staff appointments, both afloat and ashore, with unique distinction of commanding all classes of Indian Coast Guard ships, which include the interceptor boat, inshore patrol vessel, fast patrol vessel, offshore patrol vessel, and advanced offshore patrol vessels. His efforts at apprehending numerous maritime economic offenders whose activities are inimical to national interest were recognized with the award of Tatrakshak Medal on 15th August 1990, and later President's Tatrakshak Medal in August 2007 as well. A career spanning over 39 years, the flag officer consolidated the administrative framework and laid foundation for expansion of the organization in terms of capacity building, manpower, and infrastructure. Person of his stature needs no introduction, but this was a few words which we thought we would share about you. Over to you, Honorable Member Rajendra Singh Ji, for your inaugural address.
Thank you, Ruab. Good afternoon, everybody. General J.R. Bhardwaj, my friend, very dear, respected friend, O.P. Singh Ji, Professor Chandan Ghosh, Ruab Sood, and other distinguished guests. A very good afternoon to all of you. As Ruab has already said, that outbreak of this COVID-19 in 2019, outbreak of this, and finally on 10th of March 2020, WHO declared COVID as pandemic. I will take you a little in 2020 first, what we have done. From immediately after the 10th of March, Government of India zoom into action, and immediately all preparation has started. From the first week of March only, the preparation has started. From 17th of March, all international and national flights were stopped, and end of March 25th onwards, the 21 days lockdown was started. During this time, 26th of March, 11 empowered group was set by Government of India, and each group was given a task. Empowered Group 6 was looking after the logistic supply of food and essential items. I was in the part of the group number 6, and we were 9 members was there, including Food Secretary, Consumer Affairs, Joint Secretary from PMO, member from Cabinet Secretary, and Indian Air Force and Armed Forces also, the people was there. The first meeting we had after this lockdown was on 29th, and we sat together how to start this supply chain business. When we sat on 29th of March, generally, if you see from March 1st to 15th of March, generally on road, 24 lakh trucks was on road. Normal 22 to 24 lakh trucks every time they do up and down on Indian roads. On 29th, when the first meeting was taken place, only 17,000 trucks was on road. The lockdown, everybody parked there, left their trucks, and they have gone home. On that day, after the first meeting, we said we have targeted focus on 4 sectors to critical to ensure supply of essential items like food and medicines. And these 4 items I will talk one by one. First was agriculture. Under agriculture had all farming operations allowed with a special focus on smooth harvesting of upcoming Rabi season. Industries critical for agriculture like packaging, fertilizer, machinery was open up. Direct procurement of agriculture produce from FPO encouraged by central government. And by 12th of April, 70% major mandis operational. In out of 2,600 mandis, almost 1,800 mandis was made operational on following the required social distancing norm and protocol. Large mandis and suppliers to produce like Azadpur Mandi and Nasik in Maharashtra was made operational. Kirsi Rath app launched to facilitate transportation of produce from farms to mandis and traders. Last, cold chain storage units and warehouse running to store and agriculture produce. Second part was manufacturing. Forward and backward linkages for essential industrial operationalized. Pharmaceutical manufacture unit fully operational with long and smooth movement. Out of 5,790 pharmaceutical companies in India, 3,797 on 21st of April was made operational. Milk supply, more than 90% packaging and process unit was open to manage excess supply, if any. Mega food park operationalized to extend perishable and avoiding wastage. Mills for processing pulse and grain functioning to ensure timely processing and distribution. And lastly, in this sector, detailed SOP created by ministries and industries association for each sector or for industries and food processing unit, warehouse, shortage, storage unit was prepared and shared with every stakeholder. After agriculture and manufacturing unit, now I'll come to the logistics. Movement of all commodities is allowed, no segregation between essential and non-essential. We have D-Link acting as permit to truck driver plus one state. When 24 lakhs driver had left the track and state was not allowing, we have D-Link that truck plus one is allowed and we have allowed everybody. Total traffic handled by ports at 80% for pre-lockdown level was reached by April. 301 Lifeline Udan flight carrying almost 500 plus tons of essential cargo operational till November 2020. All medical equipment, PPE, masks, other essential items was taken by 301 Lifeline Udan. 109 timetable parcel train over 58 routes started by Indian Railway to connect important center. More than 800 racks moving day and night, carrying food grains and other essential items across all states. India Post leveraging its network of 6 lakhs plus post offices to ensure last mile delivery for essential items by their vans. Even pension was distributed by our and last was food distributions to vulnerable groups. About more than 1.2 crore people being provided with cooked meals every day by government. Support from network, from NGO, from state government, from industry player. Some states have their own scheme was part of this 1.2, more than 1.2 crore people. More than 67 crore people being provided free dry ration under NFSA 85% allocation already distributed by October and November. 3 months of additional dry ration under PMGKY scheme was distributed to all the BPL people. FCI has provided wheat rupees 21 kg and rice 22 kg for distribution to non-ration card holders. The states are also using SDRF fund to provide food and other essential services to those in need. It could happen because the center, the support state and industry through multiple mechanisms. First, I'll say center-state coordination through weekly VC and RC is relevant onto all government agencies. Active consultations with industry association, especially with FICCI and industry across domains, agriculture and pharma, etc. Every day, every week, twice a week, video conferencing was done. Regular tracking and monitoring of 15 KPI to ensure a smooth supply of essential items was ensured. Active collaboration between ministry, private sector players, NGO to deliver essential supply to all the citizens, and the last mile connectivity was made ensured. Regular tracking of media report was processed, issue related to availability of essential. Nobody in 2020 could complain anything about essential items, medicines, and others. And sharing best practices and success story by all state government was shared with everybody. Why I have talked about this 2020? Because it was the year when the first time the lockdown was experienced for 21 days, followed by 15 days, and everything came to a standstill. That is the time when we people had ensured the how to supply chain will function. Now coming to 2021, as the lockdown is not announced by center and the state government is taking care of their respective state for lockdown from evening to morning, or maybe sometime during the daytime, so that the essential item supply should not get disturbed at that stage. The only thing I like to request to everybody, the situation is quite outside. Like you have already said, that oxygen supply, medicines, and other supplies, which is looked after by Empower Group 2 and 3. I have requested yesterday also you can invite somebody from that group also, because they will be in a better position to say what is the state of oxygen and what is the state of medicine at the state. But maybe, as per my knowledge, another 3 days, the oxygen supply is going to be solved very shortly. The need to establish and set up a strong supply chain so that last mile connectivity also to be served properly. Field hospital, I like to thank FICCI in this other last week. We were having video conferencing with FICCI members, and we are very grateful to them. They have come forward for setting up the field hospitals in state also. The field hospital with adequate staff, with NGOs, with volunteers, with civil society, with the students who are in 4th year and 5th year students. We are going to set up these field hospitals with the help of FICCI member and industry member. The only thing we require is to let's come together, fight together, and let's remove these things from here. This cannot fight, India cannot fight, we can fight. Only thing is the Guru Mantra is we have to come together, share our best practices, whatever knowledge you people are sharing and having, let's share with each other. And in this field, I like to compliment FICCI, CIDM, and NIDM for organizing 3 days workshop for this, and I am quite sure that people will definitely get benefit from this, and they will, whatever they will learn from here, will make sure they will, everything will be, they will do it in their respective field. Thank you very much for inviting me once again. Thank you.
Thank you so much. Thank you so much, Honorable Member Rajendra-ji, for a very, very inspiring and very informative address. I think you've shared the vision of the entire country, how in 2020 and now in 2021, how well we are prepared and how well we are preparing for any future such situations which may arise in front of us, especially the great work being done by the empowered committees, empowered groups constituted by the Government of India, and the one which you represent, strategic issues relating to COVID management and facilitating supply chain and logistics management. I think you've put it very, very simply and subtly, work which was done effectively last year under those 4 important subheads, and how despite no lockdown being declared or national lockdown this year, still how the states are trying to cope up with the additional pressure which our country is facing right now. Thank you so much for your words. Thank you for your presence. And I know you have a hard stop, sir, but I know you would be here with us till the time you can be. But I would wish you the very best, sir. Please take good care of yourself. You've been very kind to have taken out time to be amongst us today, and we wish you the very best and healthy 2021 and many more healthy years, sir. Thank you so much.
Thank you. Thank you
for your time and blessings. Thank you. Quickly, I would now request our next dignitary, a very distinguished guest, Shri O.P. Singh ji, for his keynote address. Thank you so much, O.P. Singh ji, for being with us, and thank you for cooperating this for this change in schedule. But I know you and Rajendra ji are good friends, so I think that goes very smoothly. A brief introduction of Mr. O.P. Singh, who's the former DG UP Police and former DG NDRF, and also former DG CISF. Look at those positions he has held over the years. Ladies and gentlemen, we are over 325 people who are connected with us as we speak. Mr. O.P. Singh is a postgraduate MA in Political Science from Allahabad University. He also holds a postgraduate degree, MPhil, in Philosophy from NDC, the National Defence College, affiliated to Madras University. He has earned his MBA degree in Disaster Management. Singh Saab has served in various key positions of both Union and Uttar Pradesh government, police, like as the DG UP Police, additional DG of NCR Meerut Zone, ADG Intelligence, ADG Special Inquiry, Deputy Inspector General DIG of Moradabad and Azamgarh ranges, DIG Anti-Corruption Organization, and Commandant of 11th Battalion of Provincial Army Constabulary in Uttar Pradesh governments, and as DG of CISF, the Central Industrial Security Force, and National Disaster Response Force. He has had a very, very decorated career. He was appointed as the DG CISF in September 2016 and assumed the office of DG that very year. He has assumed charge of DG UP Police in January 2018. So many more accomplishments and achievements in his name. I would now request Shri O.P. Singh ji for his keynote address. Over to you, sir.
Thank you, Mr. Sood. I hope I'm audible to all of you. Is it clear? Okay, thank you.
Loud and clear.
First of all, I address Honorable Member Mr. Rajendra Singh, who has been a very good friend of mine in the past. We haven't met for quite some time, but we still share a very warm affection towards each other. Mr. Muzaffar Ahmed, our ex-founder member of NDMA, Professor Chandan Ghosh, Mr. Sood, General Bhardwaj. I haven't been able to figure him out on the program, but to him also, and all the participants all over the world. Good afternoon, good morning, good evening to everyone, depending on which zone they are in, and all the delegates. I'm really privileged to be invited to deliver my keynote address during this inaugural session, which was just inaugurated by Mr. Rajendra Singh, Honorable Member. This particular session, the 3-day program, OTP program, is quite relevant, and which is connected with the current pandemic as well as with the logistics and supply chain management, which is so relevant and so timely. And I'm so happy that there is a partnership between FICCI and NIDM. I remember my association with these two organizations way back a couple of years back when I was heading the organizations like NDRF and CISF. And both the organizations, particularly the FICCI, is doing such a human service to the society, and their role needs to be appreciated, particularly in the current pandemic, as Mr. Rajan Singh has already outlined. So I'm happy that this particular program is being organized to benefit almost all the citizens of the country. I mean, their recommendations, their advice to the government and to the stakeholders will be certainly very valuable to all of us. With the second wave of the COVID-19 infections, they are crashing on us currently. And it appears that this pandemic is a test of societies, it is a test of government, it is a test of communities, and it is also a test of people. 1 year into the pandemic, and we had started to make some sense of the pandemic or disease, and now the virus has made a comeback. And particularly, it's raising the entire country with renewed fury. Now, look at the scenario. You have more than 3 lakhs of cases per day, and this new wave of pandemic is going to be much more contagious than the last year. So with this background, let's begin that this COVID-19 pandemic has been the single most devastating event of the recent times. Now that we are in the second phase of the pandemic, the big question still remains, is India's supply chain ready for the mammoth challenge at hand? This is something which I have to, and we all have to think of it. India prepared reasonably well for the pandemic in its earliest stages. And as has been outlined by Mr. Rajan Singh as well, the lockdown gave the medical system time to expand infrastructure, train staff, and build capacity to absorb patients. This preparation allowed the country to manage the first wave in 2020 while keeping overall mortality rate relatively very, very low. The number of new cases began to decline nationwide after September 2020, and by January 2021, there was a dramatic reduction in hospital utilization rates. Vaccinations began in January this year, and this led to the expectations that India would be able to vaccinate its frontline health workers and the most vulnerable segments of the populations by summer, so that even if the second wave hits the country, it wouldn't be severe and the country would be better equipped to handle it. According to regional task force of the Lancet Commission, 3 factors belied the expectations. One is that the dedicated volunteer networks, special COVID-19 facilities, and emergency measures that the administration and health system had taken were perhaps scaled back and in some cases wound down just as cases began to rise. Secondly, the vaccination campaign was slightly slower to roll out, largely because of a lower sense of urgency. And thirdly, which is very important, we did not invest enough resources to study the emergence of new variants quickly enough. So what happened? Let me begin with a very famous quotation. Tom Peters said that leaders win through logistics. Vision, sure. Strategy, very important. But when you go to the war, you need to have both toilet papers as well as bullets at the right place at the right time. In other words, you must win through superior logistics. I'm also reminded of the famous quote by Napoleon Bonaparte, who said that the amateurs discuss tactics, the professionals discuss logistics. When the second wave hit India with even greater ferocity, the states were as ill prepared as they were in the initial stage. Let me take few examples. 4 temporary hospitals in Delhi set up last year was dismantled in February 2021 as cases fell to less than 200 a day. Now they are having to be revived. During the first wave, Uttar Pradesh claimed to have set up 503 COVID hospitals with about 1.5 lakhs bed. By February first week, these 83 hospitals with 17,000 beds were treating COVID hospital patients. Karnataka, with the second highest case load in the first wave, added only 18 ICUs beds with ventilators during the first and second waves. And you'd imagine that only 10 of Bihar's 38 districts had more than 5 ventilators. And the Rajendra Institute of Medical Sciences, Ranchi, the biggest government-run hospital in Jharkhand, does not have a single high-resolution CT scan machine. Now it is being procured after High Court pulled up the government. Therefore, wanting to comment and speak on the supply chain management during the current pandemic, or to be more specific, on the current challenge of making available the right quantity of medicines, oxygens, ventilators, and ICUs to the right people at the right place, the original quote from Napoleon Bonaparte and its expression by management guru Tom Peters come very, very handy. Now, let's, we have, as I said it before, that India was badly affected during the Spanish flu, which is believed to have killed up to 17 to 18 million people in the country, the most among all the countries. However, at that time, the country was under colonial rule, and the fact that the pandemic did not recur in the subsequent generations, there were no measures recorded in the institutional memory to be implemented. Nowadays, we have the framework available to us, which deals with all these cases, and we have the Epidemic Diseases Act 1897, and also the structure for execution, of which honorable member is part, the National Disaster Management Act Authority, as well as the supporting state disaster management authorities. A review of the NDMA website shows that most of the attention hitherto has been on natural disasters rather than on biological events like the current one. Perhaps they may not have got so much of attention in the past. If you look at the current capacity of the curative component of the healthcare system, you'd find that they are as low as possible by global standards. India has 0.5 beds per 1,000 population, compared to China, 4.3, compared to Brazil, 2.1, and United States of America, 2.9. And the world average is 2.9. In many ways, the state of hospital infrastructure foretells how much human loss we will suffer. In a large country like India, especially in view of the distribution of responsibilities among the center as well as the states, a centralized approach will be less effective than a federated one. However, the latter would require wiring together. If you go for the federated one, it would require wiring of together of the information systems, workflows, as well as scenario planning exercises to continually make the system more effective. In the current instance, for example, we did get 1 year to refine the mechanism, but probably complacency and little bit of lack of advanced capabilities and culture in management and technology innovations became our undoing. Supply chains have become longer, systems more complex, and unintended consequences often override the presumed benefits. Therefore, my suggestion would be that creating interoperable IT applications through enterprise architecture framework should be a good beginning, and then create customized orchestrated approach. Last mile delivery, about which Mr. Rajendra Singh has already spoken, it has experienced quite possibly the biggest changes throughout the pandemic, and they are likely to continue. Technology has enabled down to the minute product trackability from warehouse to doorstep, contact-less delivery permits, no disruptions to consumers or couriers. In 2020, it was done so beautifully by the Government of India and all the states, and decentralized roads allowed for the shortest delivery time possible, regardless of geographical locations. From enhanced tracking and logistics capable of Internet of Things devices to the insights gained from telematics, supply chain technology offers powerful solutions. Our technology prowess can help solve resource allocations problems and guide policymakers. Our top corporates, about which Mr. Sood has already mentioned, so many companies, they have the muscles to reach every nook and corner of the country in terms of logistics as well as in management bandwidth with excellent communications network. You imagine the reach of the mobile phones throughout the length and breadth of the country through their deep penetrations. They have been almost reaching the entire country. So therefore, we can make use of such things in a very dynamic and very positive manner. We have the Aadhaar, which is such a robust system to coordinate and control vaccinations and life-saving drug delivery. And we have very extensive network of NGOs, civil services, civil society organizations down to the grassroots level, apart from strong social media network. The entire national capacities needs to be leveraged in order to strengthen our supply chain management to save humanity. I would feel that the resources, energies, mind share of policymakers, frontline workers, technocrats, and resilience communities, they have to be synergized further and concentrated on the point of decisions. Friends, I would like to tell one thing, that the business models are being disrupted every day. Artificial intelligence, data analytics, cloud computing, etc. They are changing the way we think and respond to our citizens. Response times, as I have seen in my life, response times have dramatically changed. Our citizens are getting redefined in every possible way. I have been a police officer for 38 years. I know that how the response times are quickly changing. In fact, it's time for us, all of us, to challenge ourselves. The second wave of pandemic, with all its peculiarities and surprises, is presenting a formidable challenge to the nation. Such challenges demand immense knowledge and anticipation. Such challenges also demand innovative and efficient practices and quick and smart responses to thrive in the evolving landscape on the part of everyone. All of us have to do, as the honorable member has said, we all have to stand united and we have to do something. Pandemic hard handling across the country has undergone multifold changes. Over the last 12 months or so in our country, there has been significant progress. There has been significant progress in developing policies, in developing capabilities, and also in initiating legislations, capacities for risk assessment, capacities for response and early warning mechanisms have been strengthened to a great extent. Notwithstanding all this, the fact remains that India has been battered severely by the second wave of the pandemic that stretched the limits of national resilience and its capacities. Now is the time to do the best to save the mankind. Friends, in a world where major changes normally happen at a facial pace, the size and speed of the second wave has brought about very significant things. In the midst of pain and despair, they bring about new thinking and frequently accelerate much needed reform. I would like to remind the online participants that in 1918, global Spanish flu epidemic that helped create national health services in many European countries. In the Great Depression of 1929, quickly followed by World War II, set the stage for the modern welfare state. In joining this list, perhaps, COVID-19 will accelerate change in supply chain management thinking towards the new normal. In disaster management domain, response is being re-evaluated to test its resilience. Logistics and supply chain management will have to be reconsidered from the lessons of disruptions caused by COVID-19. To conclude, I must thank and I must compliment CIDM, a part of FICCI, as well as NIDM, which has both of them have organized such a beautiful platform to discuss such things. It's very timely interventions which will benefit all of us. I am really grateful to NIDM. Major General Bindal is not there, but I'm grateful to him. Dr. Chandan Ghosh, Mr. Sood, all these stakeholders in these two organizations for inviting me to address. last but not the least, General Bhardwaj. He deserves appreciation on his part for doing all such things. It is a great moment for all of us. We have to step up everything. We have to pull our resources. We have to synergize our efforts, and then only the country will march forward. And I'm very sure that in coming days, as Mr. Sood has said, that in within 3 days or 4 days, the the shortcomings of all these things will be over, and still the community is so resilient, so resourceful population we have, and so resourceful we have the private sector playing such a beautiful and such a very constructive role. I'm sure the kind of cordiality, the kind of collaborations we have with the various sectors, with the various stakeholders, we will pass through all this, and India will emerge as one of the victorious nations to fight this pandemic. Thank you so much.
Thank you so very much, Shri O.P. Singh ji, for your very, I would say, remarkable address. In fact, the core of your keynote address, what I could understand, and pardon me for my was resilience. I think that has been the core, and how the challenges have been thrown at us as India, as the community of India, and how we have to be more resilient to deal with that. And I think your keynote address touched upon such important, thought-provoking ideas also, and also issues which we are undergoing and facing right now. And I think the approach which you mentioned is very timely, is very apt, and as I said, it's thought-provoking. And people who are listening, there are about 400 people who are here on this platform, and then an equal number who are joining us on YouTube Live. I think the message is loud and clear. We have been a very resilient society as India, and I think this is the time when we have to show the best of our resilience. Thank you so much, O.P. Singh ji, for your very beautifully crafted remarks and your keynote address. Thank you, sir. Thank you. It's a pleasure to have you, sir. We as you were mentioning at the beginning of your keynote address about General Bhardwaj, he joined midway, and he was listening over to your comments as well. I would like to formally welcome General Bhardwaj. Very good afternoon, General Bhardwaj, former member, National Disaster Management Authority, former I would say founding member of National Disaster Management Authority, and the former Director General Armed Forces Medical Sciences, DGFMS. General Bhardwaj, thank you so much for joining us today afternoon, sir. It is under your leadership,
thank you, Rabab,
that we've been able to put this together. So, your comments, sir. We heard from Rajinder Singh ji, sir. He mentioned about the supply chain management initiatives being undertaken by the government of India in last year during the national lockdown, and now how that has been curated in a different manner, implemented in a different manner this time around, with more focus on the states, because it's not a national lockdown, it's more state focused. And then, of course, you heard Mr. O.P. Singh speaking about how important the resilience aspect is, and he also had some very interesting quotes from, especially about the quote from Napoleon. How important logistics is as compared to tactics in situations like these. So over to you, General Bhardwaj. We also have Dr. Ahmed, your colleague, with us, who would speak right after you. But your comments and your special address, General Bhardwaj.
Thank you. Thank you, Rabab, and good afternoon to everybody, but especially Mr. O.P. Singh and Dr. Chandan Ghosh, as well as other speakers who are here, and Mr. Rajinder Singh, who is a member NDMA. Good afternoon to all of you. I'm happy to join with all of you today, and you all know that we have had number of webinars on COVID, and but I'm very glad that this time NIDM and CIDM board has taken a very important issue where really we are not really adequate as on today, seeing the second surge, second wave, which has gone to beyond our preparation. Now, I always tell the people not to get disheartened, because one example which must be learnt and seen by every one of us is see the retail sector of our country. The retail products continuous the chain has been maintained, no citizen in the country can say that I didn't get a soap, I didn't get a bread, I didn't get atta, I didn't get dal, and that retail supplies have been maintained in spite of locking out, in spite of labor going on leave and absence of other logistic material to them. You can see the resilience in that sector. 1.5 years, the retail has been giving you all fulfill your, because reason is they produce large amount. They also think every day, tomorrow what I have to do, and they also plan that if I have to increase during feminine type or any other calamity, they are ready to give you more. Now, during this COVID surge that we had, I wouldn't say that people did not foresight, because we knew from the history that in Spanish flu also and subsequent other pandemics, it has not stayed to one wave and lasted for a few months only, because 2 to 2.5 years the Spanish flu lasted. It had 3 waves, and so that's why our scientists are still saying that don't worry, don't relax. The second wave will not be over. There'll be another third wave. Be prepared for that. But somewhere our logistics have not come up to the mark, especially on the management of the patients, the crisis expansion of beds, availability of oxygen, medicines, and initially you saw the PPE, mask and all that getting shortage, but then now it is all through. But I'm very sure in a couple of, within a week, we'll all fulfill our other requirements also, and we will see through the complete. So therefore, we don't have to worry on that. But this has been an area where it shows the significance of logistics that we have to prepare. I'm very sure during this conference, a large number of people will talk about various aspects of it, and will nourish us more on the informations. And sure enough, that we will be, as Mr. O.P. Singh said, that will come out flying successfully, flying color with flying colors out of the whole COVID situation. And with these remarks, I thank you very much, Rabab, and say best of luck for next 2 days for this conference, which will have a great success. Thank you very much. Jai Hind.
Thank you so much. Thank you so much, General Bhardwaj, for your very encouraging and motivating remarks, and summing it up so very well. Thank you, General Bhardwaj, as always. Thank you. Ladies and gentlemen, before we request Professor Chandan Ghosh for the first presentation of the day, where he'll set the perspective on this entire issue of the challenges which the second COVID wave has brought to us, I would request Dr. Muzaffar Ahmad, if he can, if he's with us. Dr. Ahmad, can you hear me? Are we audible to you?
Yeah. Thank you. Thank you, Rubab.
Over to you for your concluding remarks and your vote of thanks.
Thank you, Rubab. Good afternoon to everyone. I'm really happy to be this afternoon here for this important webinar, which is on an important subject. And I must appreciate and compliment you and your team and the CIDM board working under the leadership of General Bhardwaj, NIDM under the leadership of General Bindal, for organizing number of webinars, which was really required for the last 1 year. I think we have done more than 30 webinars, and large thousands of people got benefited. I must tell you that while we have seen the first wave, which was tackled very well, and the second wave, in the first wave, in fact, we saw the country, how we came quickly in the shape of that. We had previously, we used to get input, even personal PPE, personal protection equipment, and N95 masks, which were timely and immediately country saw to it that they were made and manufactured indigenously. With regard to our pharma industry, which is very strong globally, and we in fact exported to many countries at the time of need. And even the ventilators which we used to get from abroad, from Germany and other countries, the automobile industry, Mahindra and Maruti, came forward, and ventilators were manufactured within the shortest possible time. In third wave also, again, because of the acute shortage of oxygen in some of the states, and now many innovations have been made. Even the DRDO has now made an oxygen concentrator, which can be manufactured within the shortest possible time. And I'm sure with the working of all whether the IIT is working on innovations for making new oxygen concentrators, the problem of oxygen shortage will also come. So what really is required is the capacity building of our not only the health workers and other stakeholders. Well, ventilators have been pushed up, but how to use these ventilators by various doctors, and because we don't have enough of anesthetists in the country who can take care, because you have the patient load is so high that you have to keep people using these machines and equipments which are essential. I'm sure even the vaccination, which is a big challenge to vaccinate, and which is the answer for cutting the chain of this pandemic, this infection. It's very important that we prepare even for the now, even once the coverage of all people. First, we are focusing on 45 and above. In fact, government planned it very well to start with frontline workers, followed by the elderly age group, and now has been open to all. But again, knowing about the infection, we'll have to again prepare for booster. Whether we'll be requiring booster, and also prepare for the problems which are going to be in the third wave, where our children are going to, it has been predicted, are going to suffer, and whether we'll have to invent and see that even the masks for children are available. I'm telling you, there are various challenges, but I'm sure with active cooperation of all the stakeholders in country, and what good in our countries at the time of disasters, at the time of emergency, we are all one, and we see to it that we come out of it. I'm sure with the efforts of all the stakeholders, all of us, India will come out of this crisis, and large number of people will be saved. Thank you very much, and I wish this 3 days, the training which is going to be here with you, and I must again compliment Rubab, your team, Akhil, Manik, and Varun, and also Professor Chandan Ghosh for organizing this training workshop. Thank you very much.
Thank you so much for your very encouraging words, Dr. Ahmed. And you've been a source of great inspiration, and you've always been very supportive in whatever we do as under CIDM board, under the leadership of, as you rightly mentioned, of General Bharadwaj. Thank you so much for your comments, and thank you for sparing time.
Yeah.
Moving on, now I would quickly now request Professor Ghosh to make his presentation. There's a slight change. We would, after your presentation, Dr. Ghosh, I would request Mahesh Chandak from Bayer to make his presentation, because he has a hard stop at around 4ish. So I hope that's okay with the with other parts, with other speakers, including Yuri, and of course and Mr. Chopra. So, ladies and gentlemen, Dr. Professor Chandan Ghosh, who currently works at the Ministry of Home Affairs, the National Institute of Disaster Management. He's a professor and head for Resilient Infrastructure Division at the Institute. Dr. Ghosh has done research, training, capacity building from engineers, architects, planners in disaster resilient constructions, geosynthetics application, earth reinforcement, disaster mitigation and management, retrofitting, rapid visual screening, disaster documentation, bioengineering solutions by vetiver grass, etc. He did his first PhD from IIT Kanpur and second from Ibaraki University, Japan. Currently, his current project is revising DM plans for CPWD establishment. On that note, I would now request Dr. Ghosh to take over from here. Over to you.
Yeah. Thank you, Rubab, for this brief introduction, and also taking forward the theme of the today's discussion for today, tomorrow, day after tomorrow. And in fact, COVID second wave and road ahead, that is the main theme of today, tomorrow, and after tomorrow's discussion. Just I would take you to a few of the slides which I could collate, not as an expert, I would say, rather that whatever information, ocean and information that flowing through the various media. So I have been able to collate some of them, collect some of them, and think them certain fashion that probably would define that what we are up to at the current day. So second wave, why it is right now? Right now means where we are passing through, and what are the pros and cons, and what we have been thinking, and what actions are being taken to be taken in few hours or in few days or few weeks of time. So that is the theme that we are looking into. So the first photograph that I am showing here is like astronaut, you know, when they go, because when we have come to know that what are the typical dresses that or protection kits that they have to use, or when they are in International Space Station, what are the protections that they have to take? When they come back, what are the quarantine facility are there and how it is to be maintained? And what are the basic safety laboratory 1, 2, 3, 4 level? We have also 2 labs in our country. So when as a country, as a world, while dealing with the bio world, just putting hazard aspect or war aspect separate from the today's topic, that whatever second wave that we are facing, in the parlance of that technology, know-how, knowledge, or the kind of material that we brought from the moon in 1969, and then they are still being preserved, and how they have been saved or how they are being preserved and tested and found out what were there or not there. So when the country, as well as scientists and entire scientific community of the globe, when we have been able to devise even a mask, whether it is a rupee 5 mask available in the country, or even 500 or even 1,000 rupee mask available. When we know this, all these things, what are the 90%, 95%, 100%, or even 110% mask? Whatever 110% security or safety or filter that it can do. So when we have come to know about all these technologies, know-how, regulation, processing, and everything, and at the same time, when we know that what are the kind of safety laboratory that have to be done while dealing with biohazards thing, or while developing many of the bio-weapon, which is, of course, I say that under quote. When we know so much, then the kind of situation that we are facing, this is a Indian Express photo taken yesterday, just a few days back. Father died due to COVID, so the daughter also jumped in Rajasthan into the fire. Now she is under almost 60–70% burn. So what has prompted us to take into such a step? So that is what we are going to discuss. So the first point is double mutant. Here there is an article just today I found. Is this double mutant very particular and choosy on where it strikes? Just I have quoted over here. Yeah, link is over here. It does appear, yes, it does appear it is. Otherwise, why should it jump from Mumbai to Delhi and then to Bangalore, bypassing many other states and cities en route? Does this not suggest a pattern where new mutant first strikes the nation's financial capital, then the political capital, where we are, I am now, and next the soft power capital, that is Bangalore. So you can see the details about this. Of course, many people are there bringing up their different facts. But in this, now let us see that why double mutant is. Before that, because we have come to know now vaccine is the way out. Vaccination is going on. But why do we keep into the previous year's record or the kind of search that we had here, the kind of search that we had here after these, and now we are passing through these, now we are passing through this direction. And when we saw that our only average was the lowest among many of the top countries, like here countries are there, whether it is Italy, Iran, United Kingdom, Brazil, United States. So what sort of investigations or what kind of queries or what kind of publications or what kind of thought process is going on globally that seeing India was lowest among all these countries, which is noted over here in this bar diagram. Now it is going all in a sudden, based on the background note that which I said over here, which is collected from here. Now it is shooting up. So we are questioning to whom? So while vaccination program taken up in 2000, and at that time, and the Gavi, Global Alliance for Vaccination and Immunization, now 73 countries are there, and immunization has taken a big route now. In fact, the immunization package of 11 costing $28 in US, in our country, and it is costing more than $1,200. But now the kind of now vaccination as is all COVID treatment process that which is state, all the states they are taking now they are given, center is also assisting, and with all these things, and they are buying a lot of things, and they are also arranging whatever is the essential things, whether it is bed, oxygen, or it is cylinder, or even global tenders are also coming up by various states in the country. So now, and also at the same time, we see that when we go for vaccination as a prevention measures, of course, therefore tomorrow there will be detailed discussions by Professor Kamar. Well, we spend $1 in vaccination, we can see at least 20 times, 25 times more in terms of that human capital that we are developing. So this is something from literature that I try to put forward. But again, looking at all those areas, that whether it is America, Europe, why double mutant, or why it is a second wave? If you see over here, started everything from here, then one wave, then second wave. This is for America. And if you see India, Southeast Asia, where we are seeing it is a much lower. There is nothing there. This is the first wave, we say that September last year. Then if now suddenly we can see in the last 1 month or 2 months, we can see it is sharply rising. You see this one and this one sharply rising in our Southeast Asia. So now whether third wave is going to come or not, that you can see, this is also one kind of wave. This is also one kind of, so you can say first wave, second wave, third wave. So if we say that there may be third wave also, but now challenge is that how current data and how from here, like I want to show over here that this is Southeast Asia where it is included in India also, when there is hardly few hundred cases were there per month or per day, and now it has gone into per day 4.5 lakh. So how we are going to explain these things? How we are going to explain these things, that how come this kind of jump when few hundred to 7,000 times or 8,000 times, that how it is increasing, where this virus has got this much strength. So when you want to see that wave 1, wave 2, maybe it is not there because we maybe next 1 to 3 months or year it will tell us. But here in this case, Western Pacific, you see wave 1 or wave 1, 2, 3, 4, something like that. 1, 2, 3, like this. So where we are heading to, we are now in this phase. So now this phase still we have not seen. So that is why computer model or statistician, they are working, they are making computer models to see that what it is going to lead to. I will come into this part a little bit more detail later. Then there is one Oxford team, they have made that what is the stringency index. Source is Oxford Coronavirus Government Response Tracker. Unfortunately, we have not done any such interpretation of our data, even though that religiously we are showing our data, looking at the data, looking at the curve, it is sharply rising like this. We are still looking at the colorful, sharp rising of these things, but interpretation of the data, which maybe from the statistics point of view, and also kind of strategies that we are taking in this details, it has given 20 such parameters that they have taken. Out of those 20 parameters, if you see in the beginning, strategy-wise, by locking down, we have taken a drastic step by locking down. So our strategy parameters are very high, and we are successful in that case, containing everything under this. But now it is scoring is 75 something. What are those parameters? So those parameters are listed over here. So those parameters are listed like school closing, or workplace closing. We have not yet tried, or even if we are trying, not making a total lockdown, but we have to take into all these parameters like Oxford team has developed, and taking into account if we close the workplace, which is in some of the cities or some of the places, if we cancel public event, of course, we have many other ramifications about this thing, public event, that for the last 2 months that it was going on. And then if we keep on restrictions on gathering and or close public transport, or even if we take all together stay at home requirements like we are in Delhi in home, and then restrictions on internal movement or international travel control, which is going on, but not in that manner. How each one of these control measures, including income support that given last time and this time also, now various state governments are declaring. And what about the debt and contract relief like EMI, deferring of EMI and other things? And then public information campaigns that which is going on, no doubt, or testing policy that is going on, or even contact tracing that we have been doing in the first wave. Now almost here it is 14, there are 6 more such restrictions are there, and each of them individually together for a particular area or region, what impact it is going to cause. And this is how the stringency index is being developed. So it is developed for India. So just I carried over here to show that. But what is going on in the bottleneck about the data analysis is not coming into effect in terms of bioinformatics data that we are collecting, or decision making that which is coming time to time, and guideline that we are making. So here you can see the vaccination queue in our cities. And not only that, so many cases so far. India is in second, and India is in second number in terms of COVID after America. Here you can see these are all you are able to see in your mobile also. But second wave, yet it is going in this direction, and maybe something will happen. Of course, those projections are already there. So now you see, COVID-19 pandemic has dramatically changed our lives, of course, and from mandatory mask wearing to safe distancing, to testing, to tracing and isolating cases so as to outplay and outlast the virus. So far, so we have been doing, but now we are completely taken aback with an awe-ori colossal loss that have ever affected the mankind. We have made our railway platform. We have also made mass, grave or burning, and we are able to see all these things, and these are all being recorded and being plotted. We have made a hi-fi level of checking each and every parameter. Finally, what we are up to in treating this virus, and in fact, what went wrong and how to realign our troops against COVID, and the kind of palliative care or normal care that we are able to provide, because the virus is not treated so other than steroid. Of course, doctors' fraternity, they have all these things, and we know. And the kind of database that which are being displayed every day and getting updated in Ministry of Health and Family Welfare, or the kind of data that every day we are getting updated, how many people are dying, what is the vaccination rate, how many people are getting recovered. So we are able to churn through all this database enough. And the kind of vaccination, especially that we have taken up, how many numbers they are going, in which direction they are going, we are able to see fully vaccinated is hardly 2.5 to 3%. So it is still a long way to go. And so the question comes that, as of now, you know, with the kind of effort that entire state government, volunteer organization, foreign aids that are coming up, oxygen concentrator or oxygen production, supply, everything is being taken care of. But while going through this, can vaccine curb the mutations? Can vaccine curb the mutations? So there is a very interesting paper by Dr. Ling. So just I'm reading it. If the rate of vaccine, the answer depends on how fast vaccination take up rate. So how fast vaccination taking up rate in our country's context, and the statement, if the rate of vaccination exceeds the rate of infection. So this is obvious, this is quite, if rate of vaccination is more than rate of infection, but rate of infection is 4 lakh, but rate of vaccination is still less. So even if it is equal, but 4 lakh to 138 crore, you know, it is so many years it will take. So it gives the virus less chance to mutate. But can the vaccines curb the mutations? Now you see, easier to, in fact, like regardless of the strain, COVID has spike protein that sits outside the wall of the virus. These are all findings. Studies have shown that after mutation, the spikes become flatter. So the virus can enter a human cell more easily. In other words, the virus is better able to evade the host immune system, what Dr. Ling said. So there are many such research papers coming up every moment, every minute, every day. But now talking about the mutation, the UK and South African strain contains a mutation that let them bind more effectively to human cell. And meanwhile, the South African and Brazilian strains better at evading our immune system due to their mutations. So they have the ability to transmit more rapidly So some of the scientific explanation that that it is coming out, and perhaps the ability to cause more severe disease, but that still needs to be confirmed, because these are the just papers coming up, and results are still to be confirmed. So why mutations occurs and other things, I think, all viruses mutate. It is a part of their survival tactic. The process that, but occasionally errors occur when the virus reproduces, which is what a mutation is. And the extent of error increases the more times the virus replicates. Extent of error increases more time the virus replicates. By infecting more people, the risk of replication error also increases. So why it is 600, 700 or 2,000 times, 5,000 times suddenly in 1 month of time in India? That is something that scientists are trying to say through some of this, not particularly this, but why virus mutated. Then, like a wrongly photocopied set of instructions, the new virus cell starts behave differently and from its parent cell, differently from its parent cell. So from there, two things can arise: a variant or a new strain. So now India strain, Brazil strain, South African strain. So a variant occurs when a replicated virus blueprint has changed, but because the change is so slight, its behavior is still very similar to the parent cell. Anyway, but what we want to see that some of the graphs that I want to say that which are the Ministry of Information and Broadcasting bringing, increasing gap between COVID-19 recovered and active cases. So recovered and active cases that you can see, this is being recovered and these are the active cases. And so there are many graphs, and then you can see this number of deaths and number that which are number of cases that which is coming up. And of course, just I want to say, oxygen availability has been enhanced by increasing liquid medical oxygen, which is available through the train. You see the truck that it is being carried across the country. And also, logistics system and disruption in food supply chain, which will be, of course, discussed will be discussed detail in the next lecture. But what are those things that which can be looked into? Hospitality, construction, information, automobiles, and there are many such things. And due to the COVID, that whether it is crucial resource, logistic service, raw material, and then essential items, PPE, food supply or public distribution system, diagnostic equipment, or perishable food items, clinical cure, which are being taken care as of now. And then, of course, in the primary sectors where it is getting affected, aviation, railway, agriculture, healthcare, FMCG, and all these things. So what are the impact logistics? So logistic firms which are involved in the movement, storage, and flow of goods and have been directly affected by the COVID-19 affected. So the supply chain disruptions to the sector caused by the pandemic could therefore impact competitiveness, economic growth, and job creation, which is, of course, a lot of such research are coming out. And so the impact of COVID-19, of course, previous years, it is international that this organization that they have made these things. And then health is wealth, of course, this is, Nilesh Agarwal, Matt talks and how we have revolutionized our education system and how we have revolutionized our way of consulting with the doctor. That this is one example that Matt talks. You can see how we are adapting. And so this is already that fully vaccinated 2.5%, and current rate Indian COVID-19 vaccination may take several years. That is what it is. You can do the first calculation, but now it is how much we can buy from outside and how much we can produce or how much we can increase our capacity in the country. That is what is going on. So this is again every day you will see many such data. I'm not reading them out. And then what are the total doses that available as on date? These are also being published every day. And then what are the cases, the cumulative vaccine coverage now every day, like whatever it is going on. 25 lakh or 30 lakh it is given every day. And then what is the recent layout just few days back that there is Ayush Ministry launches nationwide distribution campaign for herbal medicine, which also you can see the big news. And also that various organizations like, as you know, is a household name in our country, but how they converted their facilities or their helping to carry the most important item these days, oxygen. And so as far as early part of COVID-19 infection, I would say that these are all transmission of the COVID-19 has appeared easier than other infections. Social distance has been recommended by WHO, but now also it is there. But if you see, R0 factor for the COVID is estimated 1.4 to 1.6. But if you see some other, whether it is Zika, it is much higher, measles, much higher, and HIV, it is also much higher. And it is all, you can see, and SARS or MARS, these are also there, which is, of course, with COVID also it is there. So in the beginning, lockdown cannot be considered as a permanent solution for a long run for an economic and social perspective, which we are facing, and we know. So that is why full lockdown has not been done. But striking consequences have been observed in the USA and European countries regarding the downfall of the economy, leading to severe joblessness within few days of lockdown in the last year. So anyway, these are, I think time is short. I would say that there are some projections that last year it was there. But crisis is different as much as it raises questions that challenge, that dominate the markets and addresses. And so I would say that now Google Maps and other things through which we are able to map, at least it is now under development, where medical oxygen is required, where bed is required. So using our IT information technology, now this information can reach to the people, and how to save ourselves from the third wave if it is going to come or it is going to come, and what are the protection measures to be taken, and what are the entire historical impact of various viruses that infected us. These are all that under biohazard level 3 level it is to be taken, then biohazard level 4, that where virus that causes severe to fatal disease in humans, and then is the most dangerous Ebola virus, 90% death. So you can see all this historical evidence of things that has affected our humanity. So there are biohazard labs are also there. There are 3 labs in our country in Pune, Hyderabad, and Bhopal. Bhopal is for especially zoonotic organism. And then the salient features for this, the last slide I want to say that why the more virulent second wave after a gap of few months of the first one. What mathematical computational models in the presence of humongous database are up to in our country as it is globally and region-wise? Is there projections for the third, fourth one in the offing? If so, what are the rudiments of footprints as on date, as on today? Is this pandemic truly natural, engineered, or motivated one? The first slide I showed some of the comments that are coming up. The health system, wellness, then immunity perceptions and drugs. Where is the key for survival now? Now there are so many post-symptomatic things like black fungus and many things are coming up. How to take up with that? Scope of arranging more health workers or more congruent planning is required, and how to look at that. Shortage of oxygen and essential drugs, production, supply, delivery. Where is the issue which is being addressed right now? Vaccine production, acceptance and criteria and delivery gap, how to cope up, that is also being explained. So roadmap for the country in terms of meeting up the demands and supply of vaccine right now is the primary one. Alternative therapy, precautions, and citizen-friendly approaches, and systematic lockdown and opening or any other approaches is to be discussed into. So anyway, to end before that, since climate change is coming up, looming large, and we are predicting a lot of things are going to happen in next 5, 10, 100 or 100 years. So with the kind of loss that database, that disaster database that we also cope up with that, with every, as and when we are approaching more and more such disaster and events are happening. And so finally, we have to see that we have to see some of this infrastructure, water, land and soil, we have to save, we have to make a combination of these things, not entirely through a drug development based on chemical industry, but we have to look at this water and land and soil and overall all these things that we have to go for in order to make a sustainability over here. So this is something like carbon CO2 effect on growth of life. You see 7 times more CO2. Now these days, it is being also monitored. If CO2 level is more than 1000 in a room, then chances of spreading of coronavirus, one of the paper has reported that chances of coronavirus increase if it is more than 1000 times. And so there are certain devices are being made now with LoRa technology that where we can also pathogens movement from men to or in the air or in the aerosol, those can be checked now. Thank you.
Thank you so much, Professor Ghosh, for that very enlightening presentation. In fact, you not only set the tone and perspective for this, but you because this OTP has 2 elements. They are interlinked, but they are clearly 2 elements. One of which is understanding the second wave, that's understanding the COVID wave, second wave, and also the supply chain management issues, which have which has distinctly come out as a major crisis because of the second wave. So you shared some biological data also, how on ground it is impacting, and also touched upon some important points related to supply chain management. And on that, thank you so much for that very very bright and very informative presentation with a lot of thought-provoking, I would say, statistics as well. Moving on quickly now, I would request Mahesh to take over from here for his presentation. Mahesh, ladies and gentlemen, Mr. Mahesh Chandak, who's the head of HSC, South Asia and HSC business partner for Crop Science Asia Pacific at Bayer. Meanwhile, I would request my colleague to give him the screen sharing rights. Quick introduction of Mahesh. Thank you so much, Mahesh, first of all, for joining us for this online training program. Thank you for sparing time. It is, as you can see, it's a very important initiative and a part of the series of such programs being organized jointly by FICCI and NIDM over the past 1 year. You've been a part of a resource person for us on earlier occasions also, and thank you so much for joining us today. Ladies and gentlemen, Mr. Chandak already looks very young, but has 25 years of long diverse petrochemical process plant experience in HSC, human rights and sustainability, both industry and consulting experience in leading diverse teams across multiple continents with projects experience in 20 plus countries, demonstrated ability to shape global HSC strategy, partnering with regional teams to provide guidance and lead execution at ground level. In his current role at Bayer and Monsanto, which was acquired by Bayer, achieved a step change improvement in the organization's HSC and human rights performance in past 8 years, collaborated with organizational leaders and managers at all levels to enroll them in HSC vision, inspired employee commitment and mentored HSC team to enhance their development and drive performance. Recognized as HSC and sustainability thought leader in various prestigious industry forums and as jury member for several esteemed industry awards. Ladies and gentlemen, I present Mr. Mahesh Chandak to you for his presentation, which would be titled Ensuring a Resilient Supply Chain During COVID-19 Times. Over to you, Mr. Thank
you for your kind introduction. Thanks, Lily. Thanks, Akhil, for reaching out, and it's my pleasure to speak here to all of you. So friends, today I would like to share very practical, simple tips which you can follow so that your facilities, your company, your supply chain, is resilient, can operate through this pandemic. I think our earlier speakers kind of highlighted the risks of the pandemic. So today we will kind of focus what we can do, in that environment which our earlier speakers have shared, and operate. So when it comes to your companies, it is your sites, it's your people, and it is the communities around you, So we will share some aspects of all this, and these are just my practical. I'm no thought leader in this, but just our experience trying to operate as a company is what I will share. So for those who don't know, Bayer, so Bayer is into 3 divisions mainly. We have the biggest division, which is our crop science division, in which we have seeds, crop protection chemicals, and farmers are our customers. And as you know, we have to ensure food security. We don't want this health crisis to be a food crisis. And so we have to make sure that farmers get the seed that they need, the chemicals that they need, and operate. And as you know, last year, almost 11% growth in sowing area was there in spite of the pandemic. And this year again, looks to be a good year with rains on time. So we have to ensure, for us, the big challenge for crop science was to ensure that our factories keep running so that the farmers get the product that they need. And also the support, It's not just the product. We have to handhold them to help in this pandemic. Second is pharmaceuticals. We have to ensure that the drugs, medicines are delivered to the customers. And last is consumer health, which is our new business here in India. So moving on. Yeah. I think our earlier speakers talked very nicely about the second wave. Now, what is the difference in our own perception in the second wave? As we look at 2020 and 2021, in 2020 at around this time, April-May period, you will remember that the COVID spread was very less, but the fear of COVID was very high in our mind. Now, COVID spread is a lot, almost 400,000 cases per day, but the fear has gone down. Now, it is both good and bad, the difference is last year was all about lockdown. No travel was being permitted. There was a lot of focus on building health infrastructure, PPE kits, ventilators. There was a lot of panic because we didn't know what was the treatment. Is it HCQ, or is it some other drug? Now we all talk of remdesivir. Last year we were talking of HCQ. We had a relatively slow peak, which went up in September and then went down. But overall, if you take your factories, if you take your supply chain, there was very good control of external factors. And you have to operate within that because of all these controls. Now this year, the challenge is it is unlock phase. Everywhere unlock is the new mantra. Travel is permitted, yes, with restriction, but it is permitted. There is focus on reviving economy, and rightfully so. Now there is a confidence and overconfidence because of vaccine and treatment. The wave has been very, very fast because of more virulent virus strains, as explained earlier. And overall, there is a very less control of external factors. So now you have to operate your factory in this external environment, which is you have less control. And so what the key message we need to give to our employees is we cannot stop what they do at beyond work hours. We cannot control movement of people. But what we have to do is each one take individual ownership, and we have to strengthen our self-discipline. Even micro-containment areas are not as rigidly guarded like before. At least that's my experience here, where I stay. And hence, it is our self-discipline and individual ownership. So that's how we have to somehow tackle this for our sites. Now, what it means in terms of your approach to operate, and we had to operate through the pandemic last year, this year, because as I said, we are in the essential sectors. And so for what are those self-discipline points? What are those ownership that we want people to demonstrate is in these 5 areas. So our overall message right now to our employees, and I just am showing one snapshot slide, is vaccinate when to protect yourself and others at the earliest possible, and follow the 4 golden protective principles on the right hand side. Do not leave home if you are not fit to leave home. Wear mask, hand wash and cough etiquette, and 2 meters distance. Okay, now these are very basic, simple messages. I'm sure all of you know, but these are the basics that we have to follow properly and slightly even raise the bar on these things. And I'll show you what we have done to stay safe in this 2021 wave that we are seeing. Now, coming to the first one, I have my next slide will focus on the first circle here, which is do not leave home if you are not well, what it really means. And then the slide after that will focus on the other 3. Now, when we say that, do not leave home and sick and etc. We do temperature. We all know when you go to a restaurant, right? They measure temperature, but we know it is not good enough. It is really the self-discipline and the ownership every employee has to take to do their own self-assessment, evaluate whether they are fit to come to site or not. So these are the things which we ask our employees to check before they come to site. So it goes beyond symptoms. Only the first item is related to symptoms, as you can see. And now this year we added some more symptoms like diarrhea, skin rashes, general weakness. Compared to last year, we were mainly talking temperature, dry cough, and sore throat. We also want to ensure that if employee or family is diagnosed or put in a quarantine for any reason, if they are in a society building which is quarantined, they should not come to site. Third, if they met anybody as a close contact, and by that we mean spending more than 15 minutes at less than 2 meters distance with anybody, and that person turned positive even after 72 hours after meeting our employee, we don't want our employee to come to site. So it's very important because this is how we can break the chain. So if we meet somebody and the person turns positive even after 72 hours, we have spent more than 15 minutes at less than 2 meters. We don't want such employees to come to site. Lastly, we also tell employees if you attend a social event or travel interstate, now because of work from home, people can be anywhere. We say that you proactively discuss this with your manager before you come. So we evaluate each event, what the employee went, and we do a risk assessment, whether was it safe enough or not. And we always follow the more conservative opinion. Lastly, we obviously want employees to follow all the government now. So these are 5 criteria the employee has to say every day in my mind. And we don't, we trust the employees. So it's not that they have to sign a paper or anything every day. This is what we ask them to do. We also created digital forms where every 15 days they fill this up online through a digital tool. So no paperwork, but really we tell them ask this question yourself every day. And again, remember self-discipline and ownership. So everything is built on trust here. Now coming to these other 3 basic factors, we all know, I will not explain what it means, but this year our message has been looking at the way virus has been spreading. We saw that our employees were wearing, we tend to wear more fashionable cloth mask and not effective mask. So we ask people to check, are you wearing an effective mask or a fashionable mask? Ask yourself that question. And next part is, if it is just a fashionable mask, which is not effective, then you have to double mask. Double mask is surgical plus cloth or a proper N95 is what we expect our employees to wear when they step out in a high risk area or at our manufacturing sites. And we obviously provide them this at our sites. We tell them that, remember the earlier slide, right? What is a close contact? We said whenever it is not possible to maintain more than 2 meters distance, first try to do that obviously, 2 gaz ki duri, but if you cannot, then you limit the interaction to less than 15 minutes and wear the mask as given above. So this is how we are trying to ensure there is no transmission happening at site. Because we believe, as per the epidemiologists that we have in our buyer organization globally, 15 minutes at less than 2 meters is what becomes a close contact. Obviously, it will vary and it depends on ventilation, it's the indoor environment or outdoor environment, a lot of factors are there. Also, contact tracing is important when you operate a site. You cannot, yes, first option should be to not let an employee get impacted. But the second thing and more important thing also is to ensure that because of one employee impacted, your other employees should not get impacted. So then you have on-site transmission. Hence, it is very important to have effective contact tracing at sites. So every employee in buyer carries a diary where they note who are the people they work more than 15 minutes at less than 2 meters. Ideally, there should be none, but if there are, they mention. And so it is a manager's responsibility that if suppose I get impacted, my primary contacts are immediately told by contact tracing, and hence they are asked to quarantine and not come to site as a measure of precaution. So this is very important to ensure continuity, business continuity, and not get impacted because of COVID on-site transmission. Now, talking a little bit more on sites. Each site should follow strictly COVID protocols. So looking at this current situation of April and May, we went beyond just the basic protocols, what you see on the right-hand side, right? I'm sure all of you have doing that. Elimination, substitution, engineering control, administrative control. And you have some examples there. But what we said this time is we really have to reduce the risk. Our sites were located in areas where a lot of community transmission was happening. So we said, let's limit on-site attendance only to business critical tasks, and all project work, all non-essential work can get postponed because we don't want many people on site. We also thought we can divide staff into groups, group A, group B, group C, group D. And so we create one buffer group in case a particular plant, we have a site like Vapi where we have 80 acres of site and many plants are operating at that one site. Now imagine people get impacted. We have to shut down operations. We didn't want that. So we create a buffer group of employees who can step in case a particular group gets impacted or has to quarantine themselves. So this is very important, again, what you can do for business continuity. So little bit rotation of responsibility at site allows you to have people who can do more than one task. And managers, again, play a very important role for contact tracing. At site, we said no visitors and vendors, non-critical. And also, we used testing as a means at site over and above the 4 basic protocols, safety protocols, what you saw earlier. And I will little bit talk about testing as a tool. For screening, this is for screening purpose. What was our workplace testing strategy? What we said is a testing strategy makes sense in areas where you see a rapid rise of COVID cases in the community and you are not sure of the exact number. If you see many people are asymptomatic, and I think some statistics I have seen where they say 83% cases are asymptomatic in this way. So we don't know when you do temperature scanning at the gate, person may be COVID positive potentially and transmissive and comes to site because the temperature will not tell you. So what we did was, if you look at the bottom left table, the y-axis is COVID incidence in the community. So we took some parameter like cases per 100,000 people, less than 20, 20 to 50, more than 50. And on the right, we said, what is the type of activity which happens at site? Suppose when I go to site, every person has a different experience. So what is my risk of workplace transmission? So if you see the table on the top right, so if I was to go and attend meetings at sites, or I was a critical production worker, etc., then I am a high risk for the company. Low means I am a general office employee who goes and work alone on a computer. I am a low risk to others and others are low risk to me. Medium is somewhere in the middle of these two. So we said every employee will be subject to this matrix on the bottom left, where if I am coming from a community, let's say, which is more than 50 cases per 100,000 and I'm a high risk, then I'm classified as a red category. So what is the recommendation for red category? The recommendation for red category in most cases is testing may help increase protection. So we do weekly antigen testing for employees who fall in this red high risk category. So as long as the community cases are rising and I'm operating in a high risk activity at site, the risk of workplace transmission is high for me, then I become red. And for red category, weekly testing is being done. When we did this weekly testing amongst all the high risk and medium risk, we found around 1 to 2% people turned out positive. And so then we asked them to work from home or go home and seek medical attention, and we supported them. So testing can help when you are in a very high critical activity, in a high rate of virus transmission, and you want to have additional controls against the virus. So just sharing a practical experience. Yes, we all know antigen is not as accurate as RT-PCR, but we are not using as a medical tool, it's a screening tool. So we found it works the way we are doing. Now, the second very important part is employees in this whole journey. And we have to take care of employees. If we don't take care of employees now, they will not have the motivation to work with a lot of productivity. So we really put our brains together, all the enabling functions in the organization. We put in some measures in place. I just want to highlight a few. I'm sure you have people on the call, you have your own very good measures, and you can put them in the chat so that I can learn from that, and others can also learn what other extra measures you're doing for your employees. And also, if you have questions, you can put in chat after my presentation is over. I'll try to answer them as other speakers, at least for half an hour or so. So emergency support. So we offered free medical teleconsultation to our employees over and above the company doctors that we have. So we tied up with Medibuddy, and across India, people can go into the portal and seek a medical consultation, and up to a prescription they can get free. Ambulance services, discounted rates, employee assistance program, and also a very unique thing. What I feel very good is the employee safety net. So we have employees in our big cities like Bangalore, Hyderabad, Delhi, Mumbai. A lot of employees, and these cities were very much impacted. What we did was we created volunteers of group called Safety Net, and these are people on WhatsApp group connected to each other, volunteers. Whenever there's an emergency, somebody comes through, they put in the group. Other people chip in with information. Some people make the calls. It is not easy to get a bed, oxygen, and so many other things. And you really need a team of volunteers who are systematically finding the information and helping the impacted employee and their family. So the safety net has really worked. Even in some cases, food, because whole family got impacted, they need food to be provided at home, and so other employees have chipped in with that. So this has really improved the employee engagement and care and concern for each other. And I encourage you to also consider doing that. Also, wellness advice. We do weekly wellness sessions and self-care challenge. We are running an initiative where employee has to compete on doing some yoga or steps, because we can't just talk COVID all the time. We have to create positive environment for people and employees. And the self-care challenge is an 8-week challenge that we are currently starting. COVID support policy on the top right is nothing but going above the insurance that is our employees are having. And as an organization, we said if anybody spent above insurance amount, we will look at reimbursing it for critical hospitalization, etc. And even for home hospitalization, sometimes these things are not included in standard insurance. So as a company, we said if employees spent on such things at home quarantine or home hospitalization, setting up ICU at home or hospital bed at home or oxygen at home, we will cover that cost also after some screening. We set up a 24-hour helpline, which is also very useful because employees sometimes panic and they need somebody to speak to. And this panic helpline connects them to various of these resources that you see here on the screen. And lastly, vaccination. We stand here a science-based company. We believe in vaccination. We can't make it mandatory, but we are facilitating vaccination for employees, like on-site camps, off-site camps, many things we are doing, awareness drives. Our leaders have sent their selfies, as they got vaccinated. To remove vaccine hesitancy, we did webinar sessions with doctors, and so on. It's really every employee asking each other, have you got vaccinated? Have you got vaccinated? And helping each other to get the slots. And so far, I think our national statistics says 35% of people above 45 have got vaccinated, have taken one dose. So at Bayer, we did a survey, we found 90% employees have taken. So this internal drive really helps to create environment where everybody wants to seek vaccination as fast as possible. My last slide is on communities. I think no company can operate without support of the community in normal times, and in such unprecedented times, we have to support community. We have to show we are a good corporate citizen. So we have done our small bit for the community, whether it is providing them masks or food for the marginalized. Also, in many cases, we sponsored beds in hospital as they expanded capacity. We supported them on that. Our chemical plant at Vapi is creating an oxygen generation plant from the existing nitrogen plant that they have. We imported zeolite for that from Germany at very short notice. So it gives the right quality of the medical oxygen that is required. And lastly, we have an inoperated site which we have given to government, and that is operating as a COVID care facility. And several people are using that, and that is run by the government. So that is all I think wanted to share our experience, for employees, for communities, for our sites, and how to make our supply chain resilient. And one of the things also in all this thing is we have also taken our other partner organization along, whether it is a supplier, vendor. We cannot operate in silo. So we have also shared tips with them so that they can also operate 24/7 without getting impacted, because unless the whole value chain operates, a product cannot reach the customer. With that, I will stop. Rubab, over to you.
Thank you, Mahesh, for that. For that presentation. I think you described and you demonstrated some very key elements for the success, which have gone behind the success of Bayer's operation, especially in the past 1 year. And you also mentioned a very interesting figure that the numbers have the trend is upwards. 11% last year, and this year also you're expecting something on the same lines, right? The impact has been a positive impact. You've been able to manage. Can you say a few lines more on that?
Yeah, so COVID is a very unprecedented situation. Some industries get impacted and some get positively impacted. So what we found last year, the acreage under various crops in Kharif and Rabi went up by 11%. Also, farmers, we have been handholding farmers a lot. We have done, you won't believe, like the way we are doing this webinar for industry, our sales team has connected with farmers through the mobile and digital. In fact, now we have to stay, even after COVID, in the new normal, we have to continue with the digital connect for farmers. And hence, the farmers are using, the right technology. And hence, though their acreage has gone up by 11%, their consumption has gone up by almost 15 to 18%. So they want good technology, they want, best-in-class seeds. And because of that, their productivity goes up. And if their commodity prices are good, that's the way to bring them out of poverty. So we have also, created, even during the pandemic, something called Better Life Farming Centers. These are in collaboration with other seed companies and other agri companies, where a farmer can go and get some advice. So smallholder farmer is a big focus area for us. If they are successful, we will be a successful company in future. So it's not just about selling something today. It's about creating a strong customer for future, on which even during COVID we saw we could do because of the digital and other.
Brilliant. I think that's the example, and that's the key takeaway coming out of your presentation. I think although these were unprecedented times, they were also what Mr. O.P. Singh mentioned during his keynote address. A challenge which was thrown on the community. From all ends, we thought it just take everyone down. But then it was the resilience, especially displayed by the private sector. When I say private sector, I also mean, I mean the entire corporate sector, which involves public sector undertakings also. How they got together and became a strong pillar of support and delivery for the government. And I think this is the biggest takeaway from this crisis, that how private sector, when it steps up and join hands, we've been trying to do that for a long number of years. But I think, like in the Western countries, you dig deep into their success formula, you will find a very significant role of the private sector. And I think the example which you gave, it supported the base of the pyramid population of the country. An example where the farming community, which is an integral part of the entire supply chain, if they were strengthened and if they were given, if enough resilience was added into their survival, I think it helped the entire country to deal better with the situation, I think.
And as private sector, needs support of government. I'll give an example, just live example. Yesterday, to convert a nitrogen plant at oxygen. Hospital agreed. Now we need a zeolite. It's not available in India. Zeolite is available in Germany. Zeolite came on flight yesterday evening, and in 3 hours, 4 hours time, it was on road to Guwahati. All customs clearance was done so fast without us paying any price. So I think it's a dialogue and engagement in crisis. Private sector is to engage through organizations like FICCI with government, and whether many times you ask for surveys, how many of us actually contribute to that, right? We sometimes don't, or participate, or raise the right questions. So I think this is a time where we can all step up and do, and not forget the employee and community in all this, because private sector can't be resilient if the employee is not resilient or community is not supportive, because workers come from the community. So thanks, sir.
No, thank you so much. And that's why you also mentioned very key points which people might be wondering, why you were also demonstrating what Bayer does within the organization. And I think unless you are resilient on your own, as they say, even for firefighters, if there is a crisis, if there is a fire, you're there to save lives, to rescue lives, not give your own lives away. And that is the fundamental. You have to be resilient, you have to be prepared yourself to help others. And I think this is an example which has been well demonstrated, which is positively impacting the supply chain, which is linked to Bayer and its operations. Thank you so much, Mahesh, for that very detailed, very informative presentation. And I must compliment you and your organization for doing a fantastic job and being playing an important role in helping a country fight this crisis. Thank you. Thank you. Dr. Ghosh, before we move on to Yuri, would you like to make any comments?
No, it is very nicely presented, and also the kind of interaction that you had. Very well, very nice. Maheshji, really great. So we can go to the next presentation.
Thank you so much. Thank you, Professor Ghosh. Moving on, I would now request a next speaker, a very eminent speaker, Dr. Yuri Arshavsky, who's the Chief Data Scientist, RSRL Research Initiative from Israel. This is where our platform brings international expertise available to our industries here in India. Thank you so much, Mr. Yuri, for joining us. Dr. Yuri, sorry, for joining us today, sharing time to share your knowledge, your expertise, and your insights, on this very crisis, which not only our country here in India, but globally the countries are facing. A brief introduction of Dr. Yuri, ladies and gentlemen, before I hand over to him for his presentation. Dr. Yuri is one of the key developers of Arshavsky Majumdar 2020 model of RSRL. RSRL is advisory, founded in 2010 as an ETH Zurich spin-off with a group of mathematicians. RSRL, this particular model, Arshavsky Majumdar 2020 model of RSRL for COVID-19 pandemic research tool, is already known as decision support system tool for sovereign institutions across boundaries. Dr. Yuri graduated from the University of St. Petersburg in Russia, specializing in automatic control systems for mobile objects, and secured his PhD on the same topic. Since 1995, he has been living in Israel. His specializations are in the development of AI for visual monitoring systems, medicine, real estate, and disaster risk, especially loss simulation models on cyclones and earthquake. Dr. Yuri, it's a privilege to have you and to welcome you to our online training program. It sounds very basic, but it's something which connects almost 500 people from across the country, and also from neighboring countries, from Nepal, Bangladesh, and even the UAE, to our platform. Thank you so much for being with us and agreeing to be a part of this training program and contributing to this. Over to you, Mr. Yuri, for your presentation.
Thank you. Thank you very much. At first, I would like to thank the organizers of this conference for the opportunity to share the results of our research at such difficult time for India. We hope that our approach to modeling and prediction the spread of the pandemic will help make those but necessary decisions. A few words about the history of the presented model. My family and me became seriously ill with COVID-19 almost a year ago. It was very, very serious. After that, my key partner, Chitra Majeval, and I decided to do something to help other people. So the idea was born to develop AI to predict spread of the pandemic. After 6 months of work, we hope that our AI will really help in the war against the pandemic. My key partner of the whole exercise, Chitra, he founder of the RSRL Global Research Initiatives and chief strategist of sovereign institutes. Chitra very, very strong in fundamental mathematical research and applied probability theory through the excessive risk measures model and through leadership. Our model is one of modification of MCL, taken into account extended parameters like incubation period, the presence of a large number of asymptomatic but infections patients, information about tests and confirmed cases, the discipline of self-isolation, the quality of the vaccines and used in the country, on the area, and the speed of the vaccination, and the factor of the behavior of the population in period of their COVID pandemic. As an optimization platform, it is a neural network. We choose that it is very, very deep neural network, the number of layers of which corresponds to the number of the days of the history of the pandemic. Currently, there are about 500 layers. It's very, very deep layer, the neural network. And they use the popular automatic differentiation technology to generate and train the model. Our target is minimize the unknown variables recognized during the training. They are primarily infected, asymptotic proportion, and pandemic spreading factor. It is our model. Okay. Our model is based on the analysis of the entire history of the pandemic in the specific area. It can be country, city, or even a village. During the training process, the model calculates the most important non-measured dynamic parameters, which is the key to making a decision to combat the pandemic. I'm talking about the number of people who actually survived COVID-19 and have immunity. The people survived the COVID and vaccinated population are barrier to the spread of the pandemic. Everyone knows that this phenomenon as herd immunity. Our model allows us to evaluate and predict this herd immunity as time domain dynamic factor. A huge number of COVID-19 developers of other people, other models are based on the use of the spread factor R0 as a constant measured by statistical analysis. Assumptions are also used about the actual infected population and the survival in the disease with immunity. We think this approach not so correct. We found that even a few % difference in the spread factor, rate factor, can be a reason for the dramatic difference in the dynamic of the pandemic. The example in the last period, for example, in India and Bangladesh. Now our model computed that factor in India now is about 1.2, and in Bangladesh, 1.1. I think it is so small difference and so big difference. Of course, we set and advance such parameters of the model as incubation period, vaccination success rate, self-isolation discipline factor, and others. These parameters should be provided by a specialist, local specialist with such information, depending on the analysis area. India, it is very heterogeneous. Let's the first look in Bangladesh predictions. If you're interested, we will share later the simulations we did last night. And let's think for ourselves why they are not so heavily affected as India at the moment. But we are confident that they must keep a close eye on the situation in India. We have a plan to share our decision prediction engine and analyze with other neighboring countries for their future decision support system. A small country which has same compact population as Bangladesh on the other side, such as the Republic of India. For example, Nepal, a very low income country that is already in a deep disaster situation. Because the border is almost open here, and we cannot carry out PCR test, we thought we come and go between Nepal and India. We believe we must control what Bangladesh and Nepal is doing now. It's very, very important to predict the situation in India also. Let's now back to the description, the model again. where we need to measure the heterogeneity diversity across India according to different income levels, different socioeconomic situation. We can separate our full India model into small submodels. For example, they can be different by location, by socioeconomic status. Our models can also take into account fusion between these areas and population groups. This separation will allow to refine the simulation results and make different informed decisions for different groups of the population. Second slide, it is interesting. It is the forecast chart we made in January this year for Israel. At the time, Israel had not yet reached the peak of the second wave, and nobody knew when it would happen. Our prediction took into account both current data and expected rates of vaccination. As you can see, the accuracy of these predictions is almost perfect. The difference consists in two steps. If you see it, it's one step and second one. Which are the result of the massive violence of the sanitary standard during demonstrations in the elections and the religion holiday of Purim, Jewish holiday Purim. A dynamic pandemic model is an exponential and unstable system. The long incubation period, the presence of different strains make any prognosis extremely sensitive to the parameters used. Israel is a small country, and we knew all the statistical parameters and the intentions in the government quite accurately. This determines the accuracy of our forecast. India is such a large country with different living conditions and population density that, of course, the accuracy of our forecast may be worse than for small Israel. And the presented predictions reflect some of the more or less possible scenarios. We didn't manually tune at 3 last week model parameters. It is very, very important because last month or last several weeks for the model, we cannot recognize the situation. We cannot analyze because incubation period, after incubation period, we don't have any results of incubation period. We don't have any results of the action of authorities. So the last 3 or 4 maybe weeks, it is the period that we have to tune manual by prediction of the government actions, by the situation, by the prediction of the behavior of the population to tune the model. The scenario, it's we saw in April we started to simulate the situation in India, and we suddenly got the very dramatic predictions. In the predictions you can see in this chart, it would be if vote not to do nothing, not to correct situation in India, like was in the beginning of the April, and what will be the prediction if not to do nothing. Okay, and you can see here it's here it is scenario that the second wave will arrive 2.5 million people per day, daily cases, new cases. Okay, it was so dramatic. We started to send our predictions to authorities. And here's it's a very interesting experience. There is no right or wrong prediction. There are many different predictions for different scenarios. As an example, for the influence of the statistical parameter, only one. They show the following diagram for the India. It shows the influence of such a factor as a percentage of the infected who are aware their danger to to other observe the regime of self-isolation. Now, in our model, we define that this factor is 60%. This means only 60% keep self-isolation. And in this diagram, we present what will be if increase only of 10% is this factor, what will be effect? The effect is a decrease of the peak of the second wave by almost 2 times. It is very, very significant. And in Israel, the self-isolation regime was organized in the, I think it is the best way. Delivery of food and medical supplies to the door of the patients was organized by neighbors, friends, and the government. Neighbors reported this violation of the policy. Violators were threatened by the location of the phones. As the other important factor, you can, for example, by test, there is expected delay besides not 2 days, like now, but 15 minutes. Our model can calculate the impact of this for the forecast and the financial group, the required costs. Of course, our approach is not ideal. It has a problem, as I said before, the last 2-3 weeks trained data. The long-term question period, 2 weeks dynamic and calculation basically during this period. Therefore, if the situation changes very, very quickly over the last 2-3 weeks, the forecast will also be difficult. The model requires controlled tuning of parameters of this period. It is a problematic of this model. All 6 scenarios can be calculated by financial group, comparing the cost of implementation of certain measures, comparing the results of forecast of the tools for making right organization and political decision and explanation the reason to population. I think it is very, very important to know in the population will know what will be result, what will be a result of the delay of each action by authorities and the government in their war against a pandemic. Now it is their first scenario. This first scenario, again, I have to say that it's a simulation was done in April, that our prediction was based on the extrapolation of the current dramatic situation that was in the beginning of April. And this, of course, in this situation does not change strong with regard to the people behavior and the speed of the vaccination. And the same vaccine with speed of vaccination will be before, like before with Indian generic of the AstraZeneca with 70% of the success rate. Our analysis presented in there, this figure 1, predicts a continual catastrophic situation with exponential rise of the number of daily confirmed cases till September 2021. Second scenario. It is a scenario for their vaccination rate will be the same vaccine with administered 10 times faster. It's exactly like in Israel, 2% of population per day. I think it is not real situation in India now, but any legends, the unrealistic scenario, but it's in theory, it could reduce the maximum number of new daily. It's about 3 or 4 times like maximum. Lockdown. Impact of the lockdown, we can also compute in our neural network. For example, how works this prediction? This prediction works in the like it was before. For example, if we will predict the scenarios, it will be locked down like in July in India, we will simulate their spread factor like in July. And we can simulate what will be the situation, prediction situation with new factors, with new data, with new infected, number of infected people. And here you can see it's also dramatic situation. but it is a number of the daily cases will be reduced almost by 2 times. And here, the same situation, but you can see here, the spread rate will be stronger, 2 times stronger as in July. And you can see here, it is the effect, it's 2 times less maximum of the 5 daily cases than if not to do nothing. Here it is radical lockdown. This means that all of people, most of people should be keep on their in house. It is very, very radical lockdown. It's a simulation of radical lockdown. The maximum of new daily cases will reduce also, I think it is 4 times per day, that the maximum without nothing. This scenario implies draconian measures where the overwhelming majority of the population will remain at home and for at least 3 weeks. Almost the same but temporary result will be achieved as there is a tenfold increase in the rate of the vaccination. It's all. It's only I have to add that I think we can simulate this model not for whole India. Whole India is very, very big country. If to separate India to the zones, to red, green zones, and yellow zones, and for each zone, and then in each zone maybe for each country, each city, and for each village and each area, also to run separate model with parameters that will be provided by local specialists. I think our forecast and our prediction will be more precision. It's all. Thank you. Thank you very much.
Thank you, Mr. Dr. Yuri Shasky, for your a brilliant presentation. I think it's something which is very inspiring for for all of us who are here. I would I can see a big smile on Professor Ghosh's face. I would like to hear from him first. Because no, please, Dr. Ghosh, I think
so thank you, Dr. Yuri, and also Chitra Majumdar. He is attending another parallel meeting. So that is why he could not join, but he is looking after. Thank you both, because both of you have established a model which has fit, which is giving the way to many countries. With Israel as your country is the first example that which is exactly following, and which in one of your presentation you have shown exactly that Israel also number of elections are going on and disruptions are going on. And due to that, what are the indication that came in, the surging came up and then it came down. And now you are showing that in Israel, almost no one is wearing mask. That is the first country in the world that they have made the entire country that COVID free. So it is really fantastic to see that how all this disruption like it has happened, which you are also mentioning about India case, that in the last 2 months we had got a lot of disruptions that have taken place, which you cannot help. But it is very nice to see that, fantastic to see that this also can be modeled and taken into account, and then you can predict or you can foresee. And what is strikingly noted is that if present rate of India scenario that which you have taken, if present scenario is taken and continue, and if our vaccination drive is going on just maybe 3, 5, 6 times, I think our total vaccination that which is going on, around 5 times to 6 times more than daily infection that which is going on. Like daily infection, if it is 0.4 million, and 2.6 million is the vaccination that going on per day, 2.6, 2.7, which is already 4, 5, 6 times you can say. So which you have tried to simulate that if this vaccination drive is taken to say 10 times or another double or another rate increase, then we can think of, instead of September, the peak that which you have predicted in the current way, it may come down to even June or by in the next month. So this is something that in our policy or in our, I think, Dr. Ritu Priya, Professor Ritu Priya is also here. Of course, her presentation is there tomorrow. So we'd like to see that such kind of thinking, especially the data and interpretation and the kind of measures that we are taking, that how they can help in the policymakers or guide us, which measure is stringent enough that if we take that we can reduce this. So that is what is being noted. I think it is a very new thing for us and the world to see that whatever disruptions are happening that can be simulated, and then what are the exaggeration in the peak that going on, that also can be modeled, and then how many days it will take to come down. And of course, one part is that thank you very much for taking of such a very minute thing, but in such a fantastic manner that which we need to take into account in our planning. And also, one thing that in the last part of your presentation, you are saying then we have, like in my presentation also, it started with Mumbai, Bombay, and then it came to Delhi. Overly, I'm not saying that it is somebody's statement where we can see the data. And how from few hundred daily cases, it jumps in 2 weeks of time to few thousand. And if we take it from the epidemiology or from the vector load point of view, from few hundred to several thousand in few weeks of time, then is it something like engineered, or it is something like that? How your statistical model can predict this thing, other than taking aside disruptions or geological boundary or anything? How do you?
Okay. Okay. Can I answer? Okay. At first, it's exponent. You know, pandemic is exponent. Mathematically, it is exponent. It is very important. What is the initial point of the exponent to understand what will be prediction of the exponent? So we predict of each moment of this history. We know exactly how much really infected people now on the street. It's the first. The second one is the behavior of the people, also population. Okay. At first, if the population see that the pandemic is decreased, it's not so dangerous. Okay, to go out their apartment, out there in the city. Okay, to buy something, to go to election, to the demonstration. Okay, we see it's very dangerous, very dangerous, and the infected will grow, but nobody will see it after 2-3 weeks. It will be enough for exponential. It will be enough to exponent. It will be grow extremely. Okay, it's exactly that calculates our model. Okay? They estimate the behavior of the people and estimate the really count of the number of the infected. It's non-measured parameters. Okay? It's another thing. Maybe in their mass media we see one just moment and we will arrive there immunity. Okay? It's a global immunity. But we can answer to this answer, not so. We say exactly how many people have the exactly immunity and how we close to the global immunity. Okay? It is a real measured, non-measured parameters that can calculate it by our model. I think it is very important to to make decisions for political, for authorities, to local authorities. It is very, very important parameters, I think.
So yeah. So now you are projecting that India's peak will be in September, but we have seen some Indian model from one of our institute. They said that in this month, I mean another 10 days from now, whatever peak that we are seeing now in India, like around 0.4 million per day on an average, 7-day average is about 0.4 million per day for the last 2 weeks. This may go to peak maybe in another 10 days or something, another 10 days, so then it may come down. But in your case, you are projecting it to September, means another 2.5 months or 3 months, you can say. So is there something like what are the parameters that stringent parameters that you're taking into your modeling, and whereas another modeler is showing, like in India, they are showing that no, in another 10 days it will be peak, and then what is that period, that 14 to 17 days of period of virus action? In fact, doctors say, of course, in 12 days and after 12 days, beyond 12 days, it becomes weaker and weaker. So they say that it is 12 to 17 days, or on an average 20 days. If that 20 days is taken, and now almost in India, everywhere, even in the villages also, it has spread often. So for each and every sector, if we take this 17 to 20 days as the maximum period that it can stay and no further infection will be there. Example is the place where I am talking from now. 2 weeks back here, every day 10 cases in our colony. But last 10 days, there is no cases, which signifies the observation as well as various activities that 2 weeks back it was at the peak. Now we are about 400 flats are there, and out of 400, 78 people means with their family, which was not the case earlier, first wave. Each family got affected this time. That is the second wave which is causing us. So in that case, when we are seeing that now no more cases are there in my colony now, and I'm keeping self-quarantine. So in that case, keeping this 20 days period as the maximum, it will go up and it will go down, it will come down. Then how statistical model, your model is saying that it will go with the present rate, it will go up to September, and with the current rate of vaccination also included, as you said, because you have shown few of your cases, if vaccination goes by 10 times with the current rate, then it may come down to, instead of September, to June. So, and geographical location as well as immunity that we have shown in the first wave last month, you saw that it is lowest, Indians got lowest, means less number of load of virus came to India. So there are, I think, hundreds of such parameters that to be looked into in a social spreading, community spreading, and then defining statistical model, taking these variations is really something. If you could just tell a little bit more, somehow I'm thirsty to know a little bit more about this thing.
I said that the model that I presented was based on the data from Oxford. Okay. We didn't use something specific data from India government, from India data sets. It's common data, but it's not right. Our model architecture need help for the local specialists, for the statistical specialists like you team, to define all of scenarios that can be in the future. I think it convergence of the statistical models and their neural network AI can arrive the very, very precision results. Because I said before, I don't believe to their one prediction. No, we have many predictions with any parameters, many scenarios, and to define those scenarios can only specialists and the statistical specialists, mathematics, medicals, authorities, they know exactly the local area situation. They know the behavior of the people and to predict this behavior and predict maybe action of the authorities and the government. Okay? What to do to refuse maybe religion festivals, to go to the elections, and so what are the places in the maybe city, maybe the village, maybe it's another area. Maybe to close a red area, maybe in the lockdown, maybe the strict only transportation from the red zone. All of parameters can be simulated in our model, but we need for this one, with this definition from the specialist and the local specialist.
Yeah. Thank you very much for divulging this.
Thank you very much.
Fantastic manner. Yeah.
Thank you, Dr. Yuri. I would, we have just about time for a question. I would request my colleague Akhil, please. He had a question which was very relevant, and I thought it would be good if you could put some, throw some light and reflect upon. So, Akhil, over to you.
Yeah. So, good afternoon, Dr. Yuri. In the month of February in 2021, there was a news regarding Israel that they have you have discovered some sort of a solution to this COVID-19 crisis. The EXO-CD24 inhaler treatment developed by Professor Nadir Aber at the Tel Aviv Sorovsky Medical Center, Ishilov Hospital, and it was tested on 30 patients and with moderate to severe condition. And all of them recovered. I mean, 29 of them recovered within 3 to 5 days. So we just wanted to know your thoughts on it, your comments, and will this kind of solution or similar solution be available to the rest of the world as well? What is Israel's plan on that?
Sorry, I did.
Huh?
The audio was a little cracky.
Okay.
In between.
Do you want me to repeat the question?
Sorry.
Okay.
Dr. Yuri, can you hear my voice?
Yes, now yes. Okay.
Yes.
Okay.
So this question was from Akhil. He says Israel seems to have discovered a solution to the COVID-19 crisis. I think in sometime in February, the EXO-CD24 inhaler treatment. I'm sure you would have heard of it. It's an Israel-developed inhaler treatment for COVID-19, EXO-CD24, which was developed at the Tel Aviv Sorovsky Medical Center, Ishilov Hospital, which was tested on 30 patients, and 29 of those patients recovered within just 3 to 5 days. Do you think that has been a key reason, or has that been used extensively in Israel? And what are the chances that it would be made available for the rest of the world as well?
Until now, we didn't work with the Kellogg Center. We don't know exactly what.
Okay.
It's many groups. Okay, research groups now that work in Israel. Many mathematics. Okay, and we are successful with their war with this pandemic. And today we have only maybe 10 or 15 new cases per day. It's nothing.
And would you like to comment? There's a quick question from Nikhil Kumar Singh. What is your comment on why India has failed to gain herd immunity, which was expected earlier? And is there a mathematical modeling for herd immunity? What are your comments on that?
I think it's hard immunity for India if it will be arrived with many victims. It is millions victims. I think it is not the way that you can go. I think this dramatic situation that you will have immunity. I think by our model also of our simulation.
Thank you, Dr. Yuri. In fact, while we are speaking, we are already scheduled. We have scheduled past our schedule, but we are getting loads and loads of compliments and compliments from our viewers who are almost 300 in number. Vijay Pal, Sameer, A.K. Gupta, all of them, and on the chat we have several messages coming from Dr. Devendra Kokhar, and also many of them, Vijay Pal Chauhan, Navdeep Singh, all across, also Professor Manavalan, who's a regular at all our online training programs. Thank you for your patronage, Professor. And of course, Velaru Ramesh, and all of those people who've really shown faith in our platform, and we continue to participate, and also not only participate as just mere spectators, but also contribute through questions and through suggestions, throughout the series of online training programs we've conducted over the past 6-7 months. I think this is a great example of what partnerships do, public-private partnership. A classic example is FICCI, CIDM, and NIDM collaborating. Two very strong forces have come together, which have taken the responsibility to enhance and to better the capacities amongst all relevant stakeholders of the ecosystem, especially the industry, the government bodies and officials, the civil society organization representatives, people from the academia. And I think the lineup of speakers which we have also reflects very strongly on the mix of experience and knowledge we bring on the table through our training programs. And it's the vision of our leaders, and of course the implementation of the implementation strategy of people at FICCI, my colleagues, all of them who have tirelessly been working to put this together. And of course the vision of leaders like General Bhardwaj, General Bindal, and Professor Chandan Ghosh, who to be able to to be able to curate something like this, where we have international experts, national experts, national leaders, in fact, and experienced people from the industry, like Mahesh was here, is still here with us, and then some very relevant and renowned speakers who will be joining us tomorrow and day after also for this OTP. I think heartfelt, congratulations to the entire organizing team of FICCI and NIDM to bring this to bring this in topic, which has been discussed as we speak in the media, in government circles, in the private sector circles, bringing that live subject into discussion through our online training program. I think it's the approach of our leaders, and thank you so much, Professor Ghosh, for leading us from the front. And I think we've had some great comments from all the speakers today, which started from the inaugural address of Sri Rajendra Singh, Honorable Member NDMA, who just came out of COVID 2 days back. That is yesterday only. He had joined his office after 17 days, and he was here with us. Mr. O.P. Singh, what amazing keynote address, reflecting on such important issues, the main points. He did not shy away from bringing or making important points come to the forefront. And I think this is what we need. These are the sort of leaders we need in our country to not shy away from issues which needs immediate attention. Then General Bhardwaj, his visionary address, Dr. Muzaffar Ahmad, forever very inspiring and encouraging. And of course, Dr. Chandan Ghosh's presentation today, and followed by Mahesh Chandak from Bayer and Dr. Yuri Ashwasky and Mr. Majumdar. I think we could have asked for more. I think it was a very fruitful first day of the OTP. I think I would personally call it a success, because I think we've achieved more than we had set out for. And I think we will set the bar higher for second and third day. So I think it would be a very exciting next 2 days for this OTP. Before we end, I would request Dr. Ghosh to make any final comments before we end the day for today.
No, thank you, Ruba, for giving a nice coverage of the entire day scenario and entire day program. And thank you very much. And I think our participants are also very much active over here. And let us say that bye for today. And tomorrow we have 4 presentations, which you have got the list, and please come and join. And those participants and panelists means one request from panelist side also. E-certificate will be given from NIDM and FICCI on behalf of NIDM FICCI. But provided those participants who want certificate, that you have to attend all the 3 days fully. And our computer in the background, they are keeping in record of all our timing and everything. So please be rest assured that you be here tomorrow and after tomorrow also.
Yes, and tomorrow's lineup, we have speakers from the Kodagu Institute of Medical Sciences. We have very senior emergency specialist, senior officer from UNICEF, Sarabjit ji. Then we have a speaker from Dr. Ritu Priya, who's been here, joined us today as well, from JNU, Jawaharlal Nehru University, School of Social Sciences, and then of course Professor Vasant Matsagar from IIT Delhi. So we would request all the participants to please use the same email ID which you used today to sign up tomorrow, because that's your registered email ID. We are tracking, as Dr. Ghosh mentioned, we are tracking the attendance, because that is something which is mandatory. All participants would be eligible for a certificate if they attend all the entire course across the 3 days without any exception. So please make sure that you attend the entire online training program and get the best benefit out of this. So on that note, I think we can call it a day now.
Last but not the least, please note that we are saying participants, but we are all together learning here. Experts are telling, so we are all learning. It is not only for participants, participation or certificate sake that we are attending this. It is a wonderful opportunity to connect to even Israel, the famous scientist, and also Dr. Chitra, who is in Dubai now, is based in Zurich. And also people that which has given this platform, online platform, due to COVID, about the problems, not only the problem that we are discussing, but also it is a learning, they're getting to know each other in this time of distress. So it is not only for participation and certificate, it is always a friendship and is a kind of learning from each other. That is a spirit with which we want to keep this session on tomorrow.
Absolutely. It's a one big family we are developing. I think people are just coming in and joining this family. And I think that is the beauty of our platform. So that's why people keep coming back to us for attending more of such programs. So on that note, I think we'll start tomorrow sharp at 2 o'clock again. Until then, please take care, stay safe. Be wherever you are. Don't venture out. Just be home, and that's the best. As I say, that's the best service to the nation one can do today, is by sitting at home and praying for good times to come soon.